I'm just going to talk you through swelling management post ACL surgery. Now, managing your swelling is going to be one of the most important things that you do post ACL surgery. And if you get this right, it will accelerate that early stage recovery and you'll be able to get back to a good level of function quicker. Those that don't manage swelling properly typically have a knee um, that is more painful. It affects the function because if you've not got a normal gait, they're often pushed along timelines quicker because the behind schedule. So it's really important that you get this right from day one. So we just go through the what and the why. It's just in terms of swelling, it's obviously a good thing because it's a sign that your body has gone through trauma and it's healing. So it's your body bringing all the repair hormones, etc., to the site to start the healing process, all the metabolites. But it's something that needs actively managing by you to reduce rather than just letting your body naturally recover from. So as I say, the swelling will be one of the biggest barriers to your early recovery, and it's really important that you know how to do this effectively. It restricts knee range of motion and it causes muscle inhibition, which obviously impacts function. Now, something called arthrogenic muscle inhibition. Swelling is the biggest driver of that. Essentially, it is a protective mechanism from your body where it shuts down the muscles to reduce your function to protect the knee joint, which, like I say, is a good thing. But if it stays there too long, the effects of an inactive joint and muscle is more muscle atrophy, weakness, etc., which is something we want to try and manage as soon as possible. And more swelling typically means more pain. You get that achy feeling. It's because the joint isn't functioning properly, and you compensate around the swelling. It can cause pain elsewhere. So that's another reason we kind of want to get on top of it. So if we measure it properly, we can manage it properly. So what gets measured gets managed. So how to do it? So essentially, you're going to get a tape measure. Just one of the bendy ones, is that the right word to say? So not obviously the plastic kind of tape measure, the one you can see in that video. And I'm essentially just popping it round the circumference through the center of my kneecap. Now you can see I've first measured my non-operated side. I'll just take that back. And that is essentially going to be your baseline. So that's the level we want to get your operated leg back to. So find the middle of the kneecap, measure around the circumference and make a note of the score. So on that side, the non-op side for me, it was 37 centimeters. We then measure the operated leg, exactly the same, through the middle of the kneecap, and that was 38.5. So it's quite simple. Just give it a practice. Obviously, measure around the same part every day so you can get consistent measurements. So what to track exactly? So for example, the guys that are on my program, we just input it into the app. So I've created a tracker where all they do first thing in the morning is measure the swelling. That'll pull through and it'll start to create a graph, and we can try and look at trends over time. So you can see this person, obviously swelling will go up and down each day. Um, but overall it's heading downwards. So we want to see that sort of downward trend. And then we can compare morning and night. So it's important that you do it first thing in the morning, measure it at night time, and if there's greater than a 1 centimeter difference, whatever you've done during the day is you've either done too much or you're not managing your knee properly, because we want your swelling to have reduced ideally by the evening. In the real world, most people's swelling goes up, and that's because they're probably doing too many steps. I find it difficult at times to manage my guys to get them to do less. Like for example, the first 2 weeks post surgery for me, my swelling was always down in the evening, but I was literally sofa bound for 2 weeks. I was actually really good at not getting up and moving too much. I was doing my exercise on the sofa. My step count was around 500 maximum every day. But I was in that much pain that I didn't feel like I needed to move. Whereas kind of the other guys, different pain levels, boredom, etc., will dictate how much they move. But we've got to understand that if you move too much, that's going to cause more swelling. It's going to slow your progress. And so we want to be as disciplined as possible. So if you're going out for a coffee with your friends after 1 week, if you want to get out of the house, then expect that that's probably going to have a negative impact on the knee, and make swelling worse, make the pain worse. So it's important you know how to manage swelling as well effectively so that if it does get bigger, you can get it down quick. Step count is going to be your worst or the thing that causes the most swelling. Um, overall. So, like I said, the first couple of weeks post surgery, I was around 500, probably 800 steps maximum. So if it's going up to 1,000, 2,000, 3,000 in the first couple of weeks, that's way too much. And your tolerance of movement will obviously gradually go up. It depends when you're going back to work, what your kind of lifestyle is like, and how quickly you need to get back to that lifestyle. But essentially, within the first 12 weeks, you want to be actively keeping your steps low. So if you're going out, question whether you really have to go out, because if you do, that first 12 weeks is where you can have a worse experience with swelling, where the knee's more vulnerable. The threshold to doing too much is really quite low. It's like I say, you're going to measure it morning and night and measure the difference. So if you're not in my program, you're not going to have access to my app. Just get a Google sheet, kind of two columns or two rows, morning and night, Monday to Saturday, and week by week. Just track the swelling and have the difference, and then at least you can start to get a bird's eye overview of what's going on with your knee. Because if you're not measuring it, then and your knee's sore, you don't know how much bigger it is. Whereas if it's like 2, 3 centimeters bigger and your pain's worse, well, at least you've got an explanation then, and then you can look back at your steps and start to look at the trends and put the kind of puzzle together, so to speak. So how to reduce swelling? So that's obviously going to be the most important thing. Elevate above your heart. Most people just sit out with the legs in front of them on the sofa. You want to be lying down ideally, and legs, your knee above your heart on cushions. Do that for at least 4 to 6 times a day for around 10, 15 minutes. When my knee was swollen or it was sore, if I'd done a little bit too much as the weeks went on, if I lay on the floor and put my legs on the sofa and did that for 15 minutes, then I could get my swelling down by a centimetre. So just by having it up for 15 minutes, I can manage the swelling and get it down by a centimetre. So I thought that was quite cool to see in practice. Range of motion exercises will help get rid of the swelling out of the joints. The more the joints moving, um, then the pressure of the swelling, when you take it to the end range, it will start to flush the swelling out of the joint. Obviously, if you've got a meniscus repair and you've got range of motion restrictions, that's going to be a little bit tougher. People with meniscus injuries or repairs typically take a little bit longer to get the swelling down. Quad contractions, this is really important. It's painful to contract your quads initially, but it's a contraction of the quads that will help pump the swelling out of the joint. So the more you contract your quad, the harder you can contract it. It acts as a pump and will manage that swelling better. So this is why we need to get doing quad sets 4 to 6 times a day. Um, Ideally with a complex neuromuscular electrical stimulation, and just get that quad firing and pumping, and obviously keep the step count low. Whatever else you do, you can do everything else right, but if you walk 10,000 steps a day in the early stages, that's it's gonna kind of bust your knee up, so to speak. And just make sure you're using crutches as well in the early stages. If you're not walking properly, if you've got bent knee, that's going to overload the knee joint and cause more swelling. So just one thing as well, ice does not reduce swelling, but it helps with pain. So if you're in pain and you put some ice on it, it's really soothing, it's really nice. Then do your exercises after you've put the ice on, because if your pain is less and the knee's more comfortable, you can get more out of the exercises, which manages the swelling better. So hopefully that gives a useful overview. Obviously, if you're not subscribed, then subscribe to the channel. I'm going to be trying to put out more videos like this on a weekly basis. If you're post-op or your surgery's due and you want to get on top of your swelling and manage it properly and understand how to manage it properly, and you're interested in getting more formal help with that, then DM me at RickWilliams_ACL coach on Instagram. I'd be happy to chat and speak with you there.